My name is Cherry Uy. I'm a clinical professor of pediatrics, and I'm the medical director of UCI NICU. I've been here since 1995, so we can do the math. So how long is that? That's been
16
years, yes. So I've been here for 16 years. So the care for the smallest of the preemies starts in the delivery room. So basically we attend the delivery. It can actually start even before the delivery process. A lot of times we're involved by giving counseling to the parents. We talk to them if we know that their mom is at risk for preterm delivery. So we give them counseling beforehand. And then we are called to the delivery so we can attend to the baby. So for the first thing that you will notice in very small babies, in particular the smallest of the preemies, is that they have problem breathing. So we will need to help them to breathe. We need we put the tube down their throat, we put them on a breathing machine, and the very first equipment that we will need is a ventilator. So, and subsequent to that, we will need IVs, dextrose, and we call TPN, which are basically nutrition through the vein. We will need IV access. We need isolates, those little house where these premature babies are housed for several weeks until they are grown and bigger and they can maintain their own temperature. It's really knowing that you're able to help a lot of these premature babies, and knowing that you can see them, from being a very fragile little preemies to getting healthier as days go by. And I think it is very rewarding to see when they're going home and they're healthy. I mean, obviously there are babies that will be more complicated and have more problems, but for the most part we see a lot of preterm babies that do really well and they go home very healthy. We can reassure them by telling them that this is the typical process of a preterm baby. They stay for several weeks, several months, and we kind of give them a heads up of what to expect. So I think when we do that, they are not so surprised or so stressed when babies are doing something that is out of the ordinary. It's very important, just like what you said, a lot of what we do is technology dependent. It is, we need a lot of equipment. There are newer technology as years go by. For the last 15 years that I've been in the NICU, there are so many different new equipments that has come in and that we are using right now. And the financial support that you have given us, we're planning to, both the first year and the second year, we're combining them, and we are getting a bedside ultrasound. So, it's really important because technology is changing all the time. We need new equipment, and you guys have committed to supporting us. And it will help a lot of premature babies that we care for at UCI Medical Center. I really encourage everyone to attend and support the Care-A-Thon. This is really to benefit the UCI NICU, and we want you to come and register, Dance Because You Care, for the preemies.